Hi. I'm here to talk to you about understanding sarcoma. A sarcoma is a cancer that arises from transformed cells of mesenchymal origin, thus, malignant tumors made of cancerous bone, cartilage, fat, muscle, vascular, or hematopoietic tissues are, by definition, considered sarcomas. This is in contrast to a malignant tumor originating from epithelial cells, which are termed carcinoma. Human sarcomas are quite rare. Common malignancies, such as breast, colon, and lung cancer, are almost always carcinoma. Classification tissue sarcomas are given a number of different names based on the type of tissue that they most closely resemble. For example, osteosarcoma resembles bone, chondrosarcoma resembles cartilage, liposarcoma resembles fat, and leiomyosarcoma resembles smooth muscle. Grade. In addition to being named based on the tissue of origin, sarcomas are also assigned a grade based on the presence and frequency of certain cellular and subcellular characteristics associated with malignant biological behavior. Low-grade sarcomas are usually treated surgically, although sometimes radiation therapy or chemotherapy are used. Intermediate and high-grade sarcomas are more frequently treated with a combination of surgery, chemotherapy and/or radiation therapy. Since higher-grade tumors are more likely to undergo metastasis, they are treated more aggressively. Askin's tumor sarcoma, botryoides, Chondrosarcoma, Ewing's PNET, malignant Hemangioendothelioma, malignant Schwannoma, osteosarcoma, soft tissue sarcomas, including alveolar soft part sarcoma, angiosarcoma, cystosarcoma, phyllodes, dermatofibrosarcoma, protuberans, desmoid tumor, desmoplastic small round cell tumor, epithelioid sarcoma, extraskeletal chondrosarcoma, extraskeletal osteosarcoma, fibrosarcoma, gastrointestinal stromal tumor, hemangioendothelioma, hemangiosarcoma, Kaposi's sarcoma, leiomyosarcoma, liposarcoma, lymphangiosarcoma, lymphosaarcoma, malignant fibrous histiocytoma, malignant peripheral nerve sheath tumor, neurofibrosarcoma, rhabdomyosarcoma, synovial sarcoma, undifferentiated pleomorphic sarcoma. Treatment. Surgery is important in the treatment of most sarcomas. Limb-sparing surgery, as opposed to amputation, can now be used to save the limbs of patients in at least 90% of extremity tumor cases. Additional treatments, including chemotherapy and radiation therapy, may be administered before and/or after surgery. Chemotherapy significantly improves the prognosis for many sarcoma patients, especially those with bone sarcomas. Liposarcoma treatment consists of surgical resection, with chemotherapy not being used outside of the investigative setting. Adjuvant radiotherapy may also be used after surgical excision for liposarcoma. Rhabdomyosarcoma is treated with surgery, radiotherapy, and/or chemotherapy. The majority of rhabdomyosarcoma patients have between a 50 to 85% survival rate. Osteosarcoma is treated with surgical resection of as much of the cancer as possible, often along with neoadjuvant chemotherapy. Epidemiology. Sarcomas are quite rare, with only 15,000 new cases per year in the United States. Sarcomas therefore represent about 1% of the 1.5 million new cancer diagnoses in that country each year. Gastrointestinal stromal tumor is the most common form of sarcoma, with approximately 3,000 to 3,500 cases per year in the United States. Sarcomas affect people of all ages. Some sarcomas, such as leiomyosarcoma, chondrosarcoma, and gastrointestinal stromal tumor, are more common in adults than in children. Most high-grade bone sarcomas, including Ewing's sarcoma and osteosarcoma, are much more common in children and young adults.